I would like to welcome all of you. Ask you to pray for all those in our community who have been affected by this virus. I was just brokenhearted to see the paper today, 46 new cases. We have 13 in our hospital, including some that are dear to our hearts. Just please do your best. It's all we can ask. Take it seriously. And let's support one another. I'm going to ask John Dale to lead us in a prayer before we start our meeting officially.
Are you there?
Yeah, we're here.
Okay. All right. Let's pray. Our Father in heaven, we are very thankful that you are our Father in heaven, that you're no stranger to us. And even in times of great difficulty and stress, we can come to you with our hearts broken, with our hearts needy. But most of all, we come to you with our hearts overflowing with thanks for what you have done, for what you are doing, and for what you've promised to do. And we pray that we would emphasize the positive, that we may always give you praise for everything good. And so we pray that you will work in the other things for good. We thank you for the nation in which we live, for every sacrifice that has been made to bring us to where we are as a nation. And though there are many, many things that divide us right now in this nation, we pray that you would bless us to be united on the things that matter most, that we'll always seek to be a people who are of integrity, of conscience, a people who are willing to share with others and to help one another as we struggle down the road of life. And we thank you, Father, for the community in which we live, and for those traits to be ours individually and to be ours as a community, that we'll show compassion and concern for others. Bless the CUBS organization. Bless us all that we may be healthy and that you would work in these circumstances with COVID-19 to bring about a healing, a vaccine, the things that we know we need, and the things that will help us to be more and more what you want us to be in activity, in sharing. In the meantime, bless us to be healthy, to be wise, to be cautious, and to do what we can to help other people be healthy as well. So bless this meeting to your glory. Bless the individuals who are on our hearts who are struggling right now, not only with COVID-19, but with other major issues in their lives and in their families. So bless us to be a blessing, and may you be praised in Jesus' name. Amen.
Amen. First on our agenda today is Director of Patient Access at Murray Callaway County Hospital, Vonnie Hayes Adams. Vonnie, Lord bless you in your work, and go right ahead. I know you have another meeting not too long after this one, so please go ahead and take
one thing's been constant about COVID. We've had a lot of meetings here at the hospital, and probably going to have a lot more. One of the things I do want to talk about today is our charity program, but I know I'm on a call today with people who love this community as much as I do, and I know everybody's anxious when you see 46 cases in the paper yesterday. It is quite something that I think we kind of got lulled into thinking maybe we might not have that number of cases. I hate to be the bearer of bad news, but I feel like that number will probably be larger today based on the number of positives we had this morning already that we know of that came in yesterday afternoon after that announcement was made, and then just the ones that we had with our first, what we call data dump this morning. It's probably at a point, I did talk to the hospital leadership this morning, and we are probably at a tipping point in the community where it could go either way for us, in that all of us who are in healthcare in our region are in that state at this moment. Everybody is at a point where we are pretty well maxed out. For example, our CCU unit and our progressive care unit have been at 100% consistently now for the past 7 days, which means there's not a lot of room for error on our part as we move and transition people in and out of our facility. And that would be the same for all of our surrounding hospitals, Marshall, Jackson Purchase, and then the 2 in Paducah. We do have some input from Katie's as well, from the Trigg County facility. And everybody is in this same boat where we're all just sort of holding our breath to see what happens next and to see what the communities as a whole do to try to do what they can to prevent the epidemic or the pandemic from getting more widespread. Basically, the facts are that if we had 46 positives, statistics tell us that those 46 people probably infected 2 more people before they knew they had the virus themselves. And so you can just sort of start to do the math. So if those 2 people who now were infected that didn't know they were infected, they've all infected 2 people. It's kind of like those games that you played before where it grows and it kind of becomes out of control very, very quickly. So from a hospital standpoint, we would like everybody to be diligent, which pretty much is what everybody's already said. Wear your mask, wash your hands, social distance, avoid large groups and gatherings. All of those things that we've been hearing all along are really the only preventative measures, but they're also the best preventative measures to help us sort of calm the waters and maybe keep this from growing at an exponential rate that will be beyond our hospital's capacity, because it is for certain there's nowhere for us to go. Our surrounding hospitals are in the same boat we're in. And in the past, we've been able to rely on each other when there's been large capacities of various patients for all needs, not just COVID, but just strokes and heart attacks and and that's just not going to happen this time. There isn't that accessibility amongst us where we can all work together. And so that's important for everybody to keep in mind. Is it's not just COVID. We have the patients we've always had who are sick and need our care. But when you add in a large component of patients you've never had before, it gets pretty serious pretty quick. I don't know if anybody has any specific questions that I can answer or not.
So if you have any questions, feel free to throw them in the chat and we can try to answer those. Well, Bonnie will try to answer those.
Yeah. Our testing site is still open in the west entrance of our hospital daily from 9 to 4. It is a COVID swab up your nose. It's the most reliable form of testing, and it takes us about 48 hours to get your results. So if you think you have been exposed or someone's told you you've been exposed, that's a good place to go to get tested and not even have to get out of your car.
So Bonnie, can you also give us just a little bit more insight into some of what you normally do there at the hospital?
Sure.
I know you and I have talked before about different programs that are eligible.
The main part of my job is what's called patient access, and that's so if you are working with a client and they are accessing any of our services here at the hospital, whether it be for surgery, maybe they're coming to the outpatient lab, our ER, any of those types of places, the individuals that they encounter, the first person they meet is someone who is a part of my team, a part of my staff, who's going to try to make that a pleasant experience as possible, depending on the circumstances, to get the information we need to help them get their correct insurance in there. If they don't have insurance, we have a mechanism to hook them up. We have a person here on site who will work with them to see if they qualify for Medicaid. A lot of folks don't know that person's here, but he is. He's here Monday through Friday from 8 o'clock in the morning till sometimes very late in the evening, depending on what's going on, this particularly in our ER. That is where his office is located, is in the ER. And he tries to help those who come in who don't have any insurance or have lost their insurance coverage to get them signed up quickly on Medicaid so that people aren't afraid to be sick and afraid to come here because they can't pay their bill. For those who do need help with paying for their whatever they've had done, like after the fact. The other part of my job is what's called charity care, and it's not something that we advertise, but there is a number that's given on all the bills that we send out from the hospital to let you know that you can call that number. And if you do, eventually you're going to get in contact with me or Debbie Smith, who is our financial counselor here at the hospital. And we're going to work through an application process with you, which sometimes when patients first get it, it seems a little bit overwhelming, but it's basically what the government requires that we document to prove someone's income and their citizenship within this county and the state of Kentucky, because those are the things that govern the money that we get reimbursed when we offer charity care. And so I have to have all those in place. But in reality, it's not that different from what a lot of the CUBS agencies would be requesting as well. You know, it's copies of pay stubs, copies of a residency. You know, you got to be able to show us that you have an apartment or you pay utilities or you have a driver's license, something that can prove that you live in Callaway County. You don't have to live here to be qualified, but you must work here if you don't live here. We do allow Murray State students who have a temporary permanent residence that's not on campus to also be eligible, and may or may not have to include their parents' income depending on their individual status when they apply for charity. But our charity goes up to 300% of poverty. And so it's pretty high. You know, a large percentage of our population in Callaway County would qualify for charity care with that high of a poverty rate. For example, a family of 4 with a gross income of $78,600 would qualify for charity care at a 25% rate. And so that would mean you would get an additional 25% off after your insurance pays or you pay, self-pay, whatever the case may be. The other option that many people aren't aware of is that we also at this hospital work with a company called Med Financial that will work with you to set up payments for your outstanding medical bills, as low as $50 a month, depending on your income. In the first year, there's no interest on that account. And so there's lots of ways to help people pay for their medical care that we try to work with people, or at least reduce the amount of cost that they have. And so that program itself, it's going to sound really strange, but that amount of charity that we submit as a hospital each year on our books, we actually get a reimbursement from Medicare at about 25 cents on the dollar for every dollar that we give in charity care. And so it's not like the hospital is totally having to write off someone's care. That's not what we want to do. We want to be reimbursed for the services that we're providing. That's how we provide them tomorrow. But it does give us the opportunity to recoup a little bit of that money to help out with our expenses on the front end instead of having to wait for a long time to be paid back.
Bonnie, it looks like we've had a few questions come in, so we'll try to hit a few of these. One, while we're still kind of on the subject of charity care, do undocumented individuals qualify for that charity care?
No, you have to be a citizen of the state of Kentucky, a citizen of the United States. There is a separate program called DISH that if you are here working and you are here on a green card and have a temporary residence, there is a separate application that you can submit, but you're still going to have to meet income guidelines on that program as well. But there's another person here that does that, and it's not technically through our hospital. It is a state program.
And so back to, of course, we have several COVID-related questions. One is about rapid testing. When will we have rapid testing available in the area? And if we do get it, how reliable is it?
We don't have it here to use it at all under normal circumstances, and I'm not sure when we will. Part of our struggle as a hospital that has been from the very beginning is our market size in comparison to some of the larger markets in this country, and being able not only to access the test, but access the drugs that are out there. We do get our portion, but it is a small portion in comparison to some of the other areas. We have had rapid tests that we did get from the state of Kentucky, and we primarily use those in our senior care facility, which is, of course, Spring Creek, so that we can keep on top of the staff that are going in and out of there every day to see what their status is because of the high risk for the population that they're working in. But we have very few of those left, to my knowledge, and I don't know that we'll be getting any more.
So, and speaking of Spring Creek, are those residents staying in that facility if they need care, or are they being taken to the hospital?
It depends on the patient, their wishes, and then, how sick they are. And we certainly have had some of those patients transfer to the hospital. We have had some that have chosen not to do that because they may have in place, a living will, a do not resuscitate order, those types of things. So it's really not a situation, because if you come to the hospital, of course, those are the things we do here. We do life-saving measures. And so for some, that is not that family's choice. They already have the legal paperwork in place to not make that decision. But there definitely are some here at the hospital now.
So, and as far as care at the hospital goes, just in general, not related to COVID, Gerald asked how limited is access to general services, for routine outpatient services, flu shots, et cetera.
Right now, we haven't cut back on any of that. You can still access those services just like we always have. That was part of the meetings that are taking place now and then probably next week, depending on what happens with the outbreak, because obviously at some point you have to protect those individuals coming into our environment. If we have a large caseload of COVID patients, it would be impossible to keep those two populations separated in a hospital our size. We do have a floor dedicated just to COVID patients and a floor dedicated just to surgery patients already. But in the event we have an overflow of COVID, obviously we would have to start using that surgical floor as well.
Where can people get tested for free?
You can still come through our drive-in clinic. You will have to present your insurance card. The only fee that's going to be charged, though, is just for the administration fee. The test itself is free. It's just the charges for administering the test to you. And that is filed on your insurance. If you don't have insurance, then it's free.
So basically, if you need to get tested, go get tested.
There's nothing to stop you from doing that, right? And most insurance companies, I've not seen this recalled. Most insurances are paying 100% of that administrative fee. I haven't seen any of them and I'm bombarded with it every day, of what their restrictions have been and lifted is they're still totally 100% paying for COVID issues.
And then also, how is the hospital holding up with their PPE supplies?
PPE supplies, we did have a conversation about that this morning. It's very fluid in that some days we have trouble getting gowns and masks. And then another day it may be something else that we can't get. It's somebody who was in the military sort of said it's like being in the military, which I've never been in the military, so I don't know what that's like. But apparently it can be somewhat inconsistent when you need supplies. You get this piece, but you don't have this piece. And so that has pretty much been the case really since the whole thing started, is just the amount that we may order 6 cases of masks and we might get 2. And so you don't have any guarantee. You get something, but you don't have any guarantee of what you're actually going to get. But our biggest issue has been just the basic surgical mask and the gowns.
So Vonnie, you and I talked about, you've been involved in nonprofits and the service realm for a very long time.
Yes.
And now that not that healthcare is not the service realm, but for those of us outside of healthcare, you kind of have a unique perspective as to what it's like to work outside of that field and in the field. So we see all these recommendations come through. We see all of these varying guidelines, from day to day. what advice would you give to people trying to keep their doors open as a nonprofit and provide, these services that are so needed in the community, but also recognizing that things have to look differently?
I think for people who have an underlying health condition themselves, you're going to have to be very reflective in how involved you're going to be with public interaction. That's the first thing. And everybody's going to have to decide that for themselves, because your own public health, your own public information about your health, you can't share that with the public. So you kind of have to make that as an individual decision. As I know I have these issues, and it's probably not the safest thing for me to be the front person in this particular agency meeting one-on-one with public. The main thing you always need to focus on is just assume everybody you're going to come in contact with is infected, because that very well could be the case. And if you treat everybody with those types of those thought processes in your minds, is I'm going to be sure I wash my hands, I'm not going to have any close contact, I'm going to keep my mask on, those types of things, you're doing everything that you can to be safe. There's really nothing else you could do to protect yourself at that point. But that's just having that mindset all of the time. As previously being somebody who works in the field, our love of people sometimes might make us forget, oh, I need to be careful. I don't really need to be hugging. I might not need to be picking up that child and letting them sit in my lap. I might not being able to share these items with them and just let them play with them and then forget to sanitize them. I know from my own self, it would be very difficult for me to be in your all shoes right now and to remember to do that on every single person, because your hearts are big and it's hard not to react like we've always reacted.
So step one, protect yourself.
Yeah, you have to protect yourself. And I don't want to, I don't want to scare everybody to death. I mean, even though this is a terrifying disease and we do have people who are very sick and nobody wants to be sick, it does have a fairly high recovery rate. It just takes a long time and you feel really, really bad while you have the virus. And the other part that no one knows is what the long-term effects of you having it are going to be. And so I don't want to discount that. I know that's important to bring out, is like, I think our current rate here in Callaway County is about an 8% mortality rate based on the numbers that we have seen just for us. And so that's very small, but at the same time, it's not small for those people. And, it's something that you have to keep in mind for yourself. Even though I may survive, and most people will, I don't really want to be that sick and for that long of a period of time. We've had several staff who have not contracted it from patients. We've been very, very careful here and have a very high success rate, but have had to have contracted it from family members and have been out, the required 14 days, but are still not well enough to come back after 14 days and provide care to other people. And so that will continue to be a concern for Maury Callaway County Hospital, because it's not like we have a pool of nurses and doctors sitting over here waiting to come to the rescue and work here. It's very difficult to recruit to our hospital just because we're in competition with a region that needs them just as much as we do.
So, and you kind of alluded to this when you first started. We know that we're in the red zone, and you kind of said you didn't want to be the bearer of bad news, but you don't see that going away in the very near future. So, for all of these people who are trying to figure out how to navigate, the next several months, I feel like what we have heard over and over is, and not necessarily from officials, but just kind of in general is, by summer, we should be able to get back to normal. And then I heard it was after the election, things will start getting back to normal. And, so we see all of these kind of deadlines that people create for themselves come and go. How important do you think it is to begin to recognize that this may be with us for a while, and if we want to serve our community, we got to figure out some new ways to do it?
I think probably a lot of you have already done that out of desperation. It's like, I'm going to go crazy if I can't do my job. But that is true, Nathan. You have hit on a very good point. There definitely is a vaccine that's out there, and we've already started having preliminary conversations in here. as far as that being mass produced for the masses, that's not going to happen immediately. It's a very different vaccine. It's different from any of the others that we've ever had in history. And so that presents its own set of, I don't know, restrictions or parameters that we've never dealt with before. One is how cold you have to keep it and how quickly you have to use it once you thaw it out. And there's no logistical plan right now on how that would happen once it is available to administer. So even though it's out there, and I think most healthcare people feel pretty confident that it's gonna come to fruition, it's gonna take a little while to figure out how to get that to everybody who wants to take it, and that's kind of the key. Not everybody's gonna sign up to take a vaccine in this kind of a climate. And it's not clear yet if healthcare workers are even gonna be required to take it. So on that, you're still going to have these restrictions, I would think, well into 2022 before we'll even be able to answer your question about when's this going to be over. Because I don't think it's going to be over until I don't know that it'll ever be over. It is a virus, and we're looking at a vaccine. We're not looking at a cure. Those are two totally different things. Not everybody takes a flu shot, so I'm very sure not everybody's going to take a COVID shot on down the road once we have one that everybody feels comfortable with, because most people feel comfortable getting a flu vaccine, but even still, not everybody gets one. So you'll always have a virus. That's to fight, unless you find a way to eliminate it altogether. And I guess there are people out there studying that, but right now the focus is on getting a vaccine.
All right, well, I don't see any more questions that have popped up. Do you have any other thoughts or anything else you want to share?
No, I just want to be sure everybody knows I'm happy to share that application for the charity care electronically with you. I know that sometimes your relationship with individual people is much more valuable than walking in here and them bearing their soul and all their income to me. And they don't have to do that. They can certainly get someone like you to fill out the application with them, especially if you already have a lot of the data that's required anyway. It'd probably be pretty quick and pretty painless, and then it can come back to us electronically. They don't have to come in the hospital and do all of that, as long as we can get everything notarized and signed and that type of thing outside. You don't have to actually even come in here. And most of it we can do over the telephone. So I know there's some people that don't really want to come in the hospital at all right now for any reason. And I understand that it's probably a pretty safe place to be, but it's something that I think has an intimidating factor right now when you get to the door and everybody's being temp teched and that type of thing. If you don't have to be here, you don't want to be here at all. So, but we can do most of that. So anybody that wants it electronically, I'll be happy to send it to them. And I know I had said I would get it to you, Nathan, and anybody else that's interested, I'll be happy to do that. And also the income guidelines, so that you'll know right off the bat, if you're working with somebody that has a certain income, we're not going to be able to help them.
Is that something that we could just send out on the CUBS mailing list?
I don't have a problem with that. I would want to check and make sure that my boss doesn't have a problem with that.
Okay.
I mean, I can't imagine it's not like it's a secret or anything. We've talked about putting it on our website as well, so that people can access it there. And that's become more of a conversation, especially with COVID. I mean, they don't really want people walking through my office all day long either, that we haven't tested and we don't know if they have COVID. So that's, I don't think that's going to be an issue, but I would check first before I do that. But I'll certainly be happy if you can, because I think it's something that many people don't know we do and they need to know.
All right. Well, Vonnie, thank you for.
You're so welcome.
So if you don't know Vonnie, which I kind of find hard to believe because she's involved in just about everything, it seems like, she has just been an invaluable resource for so many people. So I know that you're very, very busy. And so we really appreciate you taking the time to talk to us today. So,
Thanks,
Thank
Nathan.
you.
All right. So with that, we're going to move into the second portion of our discussion. And that's really just with all of this COVID stuff. And I'm just going to say everything that goes along with 2020. Where do we go from here? So we've compiled some resources. I'm going to share this presentation with you. if I can figure out how to do that. All right, so you should be seeing this presentation called Serving the Community While Coping with 2020. So because we've got COVID, we've got all this political stuff going on, we've got just so many issues that seems like keep coming up in throughout this year that it has been very stressful for everyone. So we're going to go through just a few different categories as to things that you can do that might help make, you know, things just a little bit easier. A lot of it's going to be stuff that you're going to go, well, yeah, we've already had to figure that out on our own. Thanks, too little, too late. But hopefully, even if it's not new information to you, it's just something that's helpful to know that everyone else is kind of going through it as well. So the first tip is lead with clarity. I think we would all agree that things are so chaotic and confusing right now because there are so many mixed messages and there are so many times that things have to change. And so it's important as, you know, service organizations that we try to be clear. And the first thing that we do is we be realistic. We have to be realistic in the sense that we have to recognize what we can do and what we should do. You know, it used to be in, you know, the nonprofit world, the question was, can we do that? And now it becomes, can we do that? And then if you say yes, then it's, should we do that? You know, is that safe for everybody? Which is not stuff that we've always all had to deal with. The other thing that I think is important is to recognize that when you're making your plans, you're making your realistic plans, you might not be able to get that 100% perfect plan in place. Sometimes I feel like we have to operate at 80% right now. We have to, you know, if we can get 80%, then we say, okay, we're going to do our best. And we know that that other 20%, we're not going to be able to hit this year because of all of these things that we have to deal with. And recognize that not everything is going to succeed. We are dealing with things that are so different than what we've ever had to deal with before. So when we're having to change our biggest fundraisers of the year, for example, and we're doing something that we've never tried before, it may not work, and that's okay. And we have to keep trying and change direction and try something new. The second tip under leading with clarity is communicate regularly. Communicate with all of your staff, communicate with your clients, just let them know what's actually going on in your world. Think about how you communicate across all different groups that you serve, whether it's your staff, volunteers, trustees, donors, and make sure to recognize what they're going through as well. So when we keep those open lines of communication going, especially right now because so much is happening at a distance, we don't get that face-to-face interaction, which means that it's even more important to stress that communication. And then, of course, be true to yourself. Stick to your own beliefs. Don't feel like you have to do something a certain way just because somebody else did it. It's kind of like Vonnie said, we have to take care of ourselves first. If it's not safe for you or you don't feel safe, you know, being face-to-face with clients, just because this other organization has opened their door and they've started doing things face-to-face doesn't mean that you have to do it as well. And don't let the fear factor get the better of you. Just remember that what you do is important. And if you can only do half of what you did last year, it's still important, and that's okay. Draw on your strengths, recognize what your own strengths are, and allow other people to help fill in the gaps. So this is a time when our CUBS network can be more valuable than ever before, because there are some things that other people do very well and are more well-versed in than me. And so this is a time when I need to be able to rely on them. Don't assume that if you can't do it, that no one else can either. Ask for help, and that's okay. And then the last one is look after yourself. We've mentioned a couple times, take care of yourself physically due to the pandemic, but just as important is take care of your emotional well-being. Don't try to take it all on yourself. There's a lot of stress. Take moments to step back, take some breaths, because you can't effectively lead any size group or serve the community if you wear yourself out. So our next tip is fundraise with compassion. So fundraising is an important part of what many of us do. If we don't have funds, we can't serve people the way that we need to. So how do we fundraise with compassion? Because I've heard, at Hope Callaway, we are running a couple of fundraisers right now because it's Hunger and Homelessness Awareness Month. And I've heard from some people that say, how can we ask people for money when they're already dealing with so much stuff? Well, the reality is we still need money to operate. So the first thing that we're going to do is begin with empathy. We're going to recognize that our donors may not be in the same position that they normally are. We have a lot of people who will donate to the same cause year after year after year. So we want to connect with our donors, but also recognizing what they're dealing with and knowing that they may not be able to give what they used to, or they may not be able to give at all, but we can be authentic with them. We can say, hey, we know that things have been hard. We recognize that, and, because we're dealing with it too. So maybe together we can kind of rely on each other. Then we're also going to detail what has changed. So many of us, not just many, I think all of us have had to change the way we do things. Be upfront with that. Talk about the challenges that you're facing because of COVID. If you're like us at Hope Callaway, I know that we have subscriptions now to Zoom. We've got, online forms that we have to pay for. We have all these different things that we used to not have to worry about. And while they're great things, they do cost money. So just talk to people about how your organization has been impacted. If you have people working from home remotely, let people know that. Let people know that you're still doing it. And in some ways, it's even harder than it was before. I think I've heard some people that say, oh, well, y'all have it easy if you get to work from home. But, that's not always true. And you all know that. It just means that we have to still figure out how to do what we always do. And we have to do it from an entirely new perspective. So it's kind of a complete retraining of our process. Share what you need with humility. We all need stuff. Figure out new ways that you can ask for things. Maybe people can't always give money, but maybe they can give something else. But a lot of times what we need more than anything is just funds to help cover our overhead costs, especially if giving is down in your organization because of 2020. So start sharing how much you need to raise by the end of the month in order to keep going. Also, look for the emergency funds and the emergency appeals out there. We'll talk about that a little bit more in a minute, but don't be afraid to ask for help, and just be honest about what you need. So engage more individuals virtually. I've seen a lot of people, even in our area, who have changed things up. We've seen virtual 5Ks. We've seen different things that happen online, like the different like performances that people have done online in order to raise money for organizations, things like that. So think about what you can do virtually and try something new. Make yourself and your work accessible. And that goes more than just fundraising. That goes with clients as well. Is there a way that you can connect with them virtually? And then finally, when it comes to fundraising, close with care. And that just means it kind of goes back to the empathy part. We have to recognize that if people are donating to us during this, that it's more of a sacrifice now than it's ever been, because there are so many things that are so uncertain. For somebody to write a check is kind of a big deal, where maybe it wasn't a big deal for that individual last year or 2 years ago, or even 3 months ago, because we don't know what's going to happen in 3 months from now or 3 weeks from now. So we want to make sure that we follow up with people, that we are, we're thanking them, and that we're also just letting them know that we're in it together, that, we appreciate your support, and here's what we're going to do with that. And then let them know what their support has done. Then we're going to operate with creativity. So this is one area where I feel like we've all had to figure out how to be creative. There is nothing that we do now that looks like it did 10 months ago. So by operate with creativity, though, the first thing we're going to talk about is just financially. There are so many grants and loans that are available now for organizations that have not been available before. So I think on Monday, we'll be sending out an email with a list of grants and loans that are available to nonprofits and service agencies in our area, that you may be eligible for that you used to not be eligible for. Because there's a lot of places who, they might have had certain criteria before, but they've recognized that need is so much greater now that they've kind of loosened the purse strings a little bit. So you want to make sure that you're checking out what loans and grants are available, that maybe you tried last year and you got denied because you didn't meet a certain criteria. You might actually qualify for that this year. Next is going to be stay connected. We already talked about how important it is to stay connected with and communicate with people. But what I'm talking about here is, with so many people working from home, we've had to go virtual. We also have to stay connected with our clients. I know I've seen several organizations that have figured out how to implement online forms. So people can apply for assistance online, or they can apply for whatever service it is that your organization provides online. But not everybody has been able to do that. And I've talked to so many people that say, I wouldn't even know where to begin. So in that email that we're going to send out on Monday is going to be a list of resources that you can use in order to make things like that happen. There's things like Google Suites is right now available to nonprofits for free. So you can use Google Forms, you can use their entire suite of software for free. And they didn't put an end date on it. So it wasn't like you can use it for free for the next 3 months. It's you can sign up for free. Now, some of their stuff is already free anyway, but they have released kind of the premium features to nonprofits. So we'll send that in the email about how you can get connected to that. But there are so many others, resources that allow you to do the same thing. There's a Jotform online that helps you create online forms that are completely customizable, and not only customizable, but they're intuitive. So based on the questions based on the answers people give, it can, generate a totally new set of questions, which is really cool. And they've made that now available to nonprofits at an extremely discounted rate. Also ask for help. In the email that we send out Monday, there will be several resources through places like TechSoup, which a lot of us use regularly anyway. But TechSoup now is offering a full resource hub to help ease nonprofits transition to remote work. And they have all kinds of webinars to teach you how to set it up. And then they're even okay with you calling. They have a helpline set up now. Document everything. When we are going through all of these new processes, document how successful things are, because, Bonnie said 2022, and that kind of scared me just a little bit. We might be dealing with this for a while now. So if you document it, you can go back and you can look and say, hey, what worked, what didn't work, how do we adapt and continue to adapt? And then lastly, constantly evaluate your budgets and your plans. So as you know, our guidelines seem to be constantly changing as to what we can do, what we're allowed to do, what we should do, how many people we can have participate in events. And so we have to constantly look at our plans and say, is this still safe? And if it is, does it fall within these guidelines? Can I still do it? And can we do it effectively? And then as far as budgets, we're coming up on the end of the year. So a lot of people are going to be finalizing their 2020 budgets. See what it is that you can do to change. If you are on a June 30 fiscal year, you've still got a little bit of time there. So the general rule is we look at budgets, monthly, and then we at quarterly we'll look at budgets and with a little bit more detail, and then annually we look at our budget and we reevaluate and we may draw up a whole new budget. With the way things are going right now, you almost have to do it monthly or even weekly sometimes, looking at your budget and say what's actually available today, because we didn't get to do our annual fundraiser this year. So what are we going to have to change and how can we make things available to the community? So I would also like to encourage you as organizations, because all of you have been doing this now for 9, almost 10 months, figuring out how to continue serving and operating the way that you do. What I'd like for you to do is shoot us an email at info@murraycubs.org, info@murraycubs.org, if there is something that has changed in the way that you want people referred to your organization. And what we will do is, probably not on the Monday email, but maybe towards the end of next week, we will try to send that out to all of our CUBS members. So when we make referrals or we are trying to tell people about what you do, we're giving them the correct information and the best way to get the services that they need. All right, and that's all that I have for you. I appreciate everybody being here today. Feel free, if you have any follow-up questions for Bonnie or questions about any of the information that we're going to send out Monday, to send that in an email as well, and we'll try to answer as many questions as we can. Also know that we're all in this together. Everyone is still trying to figure it out, and even 10 months later, I don't know that there's anyone who could say, oh yeah, we've got it, we're good to go, because every day it's different. So don't be afraid to reach out. There are so many people here today on this live stream who are dealing with the exact same stuff that you're dealing with. Don't be afraid to just pick up the phone and say, hey, it's been rough. What are y'all doing that's working? Let's lean on each other. Because I think that's what CUBS does best, is help each other.
Excuse me, Nathan, do we have this on the program you need to mention? The Canada project, or is Jennifer do that?
Yeah, so what Rebecca is talking about is it is Homelessness Awareness Month. And so through Hope Callaway and with Rebecca's help, we are selling candles this month for $10 that you can put in your window with a little placard that says shining a light on homelessness. So for more information about that, you can go to Hope Callaway's website. Thank you, Rebecca.
And they're going to be at Kroger, so.
Yeah, they'll be at Kroger on Sunday and Monday. So
from noon until 4, somebody will be there. So just give the donation. And if we run out of candles, we'll take a name and we'll have a new order coming in. Thanks.
All right, and of course, if anybody else has any announcements like that, feel free to shoot that in the email, and we will make sure those get put in the newsletter that goes out. And then if there is something that you can't wait until December 1st to send out, send it anyway, and we'll see if we can get it sent out in a special email blast. All right, thank you all for being here today. I know you got a busy day ahead, or busy afternoon ahead of you probably, so we're going to go ahead and end this meeting, and we will send out information about when we'll do this again.